Hi, this is Leslie Herhold, and today for episode 3, I'm going to be speaking more about pregnancy loss and how pregnancy loss is related to or can be related to postpartum depression and postpartum anxiety. So, pregnancy loss, or specifically loss of a baby during pregnancy, can occur in up to 1 in 4 women and is very, very common, but not commonly discussed, or not always openly discussed, which can lead to feelings of isolation and just sadness because not having that kind of connection to others or feeling like other people know exactly what it feels like to go through a pregnancy loss. It is so important after experiencing a pregnancy loss to make sure that you are taking care of yourself physically. So making sure that you are eating and drinking fluids and resting is just as important as taking care of your mental health during this time. It is also important to let your provider know if you're noticing any symptoms that are scaring you, especially symptoms of anxiety or depression, because postpartum depression and anxiety can occur after a pregnancy loss, just as in a regular delivery, because of the hormonal changes and the brain chemistry changes that can occur after the delivery. So sometimes it can be difficult to distinguish between what is normal grief and what is symptoms that are of more concern that need the attention of a healthcare professional. So generally speaking, if after a few weeks after the delivery, if you are noticing that you are crying all the time, unable to get out of bed, unable to do normal daily functioning, not wanting to take showers, not unable to take care of other children in the home, not able to return to work, those kinds of things would be more indicative of depression and anxiety, and that would need to be brought up to with your provider as well. Supportive therapy can be so good in the postpartum period after pregnancy loss, simply because a lot of women feel like there is nowheres for them to put those feelings and to not have somebody understand exactly what it is that they're going through. And even though every loss is so different, there are some commonalities in how women who have lost a baby through pregnancy, how they feel and how they are treated afterwards, and how they are left to go back to work and go back to normalcy, even whenever everything feels so different for them. So meeting someone else who has been through it before is it adds to that connection, and it adds to or it decreases those feelings of loneliness and isolation that can happen after a loss. So it is really important to be very, very gentle with yourself and very unapologetic about whatever it is that you need from family and friends. If you need people to leave you alone for a little while and give you some space and allow you to heal, that's okay. If you're needing people to help you with specific things like laundry and cooking and cleaning, don't be afraid to ask for help also if that's what you're needing. So friends and family members, people who love you, are going to want to do anything they can to help make this a little bit easier on you. And even though there is nothing that anyone can say or do to make the pain go away, there are some things that you can have family members and friends do that might help you out, even if it's just for a moment. So asking them to cook a meal or cut the grass or do a load of laundry can be very specific things that they can do to feel like they're helping, and it does help you in just for the short period of time. So recognizing too that even though friends and family members may want to help, there still may be some things that are said that can be very insensitive, but even if they are said out of love. So clients will tell me that they hear all the time things like, well, you're so young, you can have more babies, or well, it just wasn't meant to be, or this was God's plan, things like that. I think people feel like they want to help and they want to say something that helps make this a little bit easier, but of course there's nothing that can be said besides, I am so sorry. I know this isn't what you wanted, and I know this isn't the outcome that you expected would happen. So yes, even though you may be young, and even if you went on to have 5 more babies, none of those babies is going to replace the baby that you lost, because you wanted that baby. And it is okay for you to be sad. It is okay for you to be angry. It is okay for you to have whatever feeling you may have right now. There is no right way and no wrong way to react to a miscarriage or a pregnancy loss. Everybody is different. And even though everyone reacts differently, there are still some common feelings associated with loss. So that if you are able to connect with other women who have experienced a loss, it can be extremely, extremely supportive and therapeutic to be able to meet other women that have gone through something very similar, because it helps you to feel like you're not alone. And because unless you've been through it, you don't know how you would feel. You don't know exactly what it's like. I have many clients who come to me in a pregnancy after the loss of their previous pregnancy, and they seek counseling because they are either feeling extreme anxiety and worry, or indifference, inability to be excited about this pregnancy because of the loss. And that's extremely common and extremely normal given the circumstances. Many women are anxious during a subsequent pregnancy, and there's really not much that anyone can say to make that anxiety go away. So in those moments, it's about validating those feelings and saying, yes, I am anxious right now because I'm scared, because I know now that it is possible to lose a pregnancy even whenever I do everything exactly correct. So making sure that you are taking good care of yourself physically and emotionally, seeking counseling if necessary, reaching out to other women who have experienced pregnancy loss and subsequent healthy pregnancies can be so helpful as well. Making sure too that you are mentally preparing yourself, in that you are saying, okay, I am going to be anxious, and that is understandable. I am going to be scared, and that is understandable. It may take me a minute, it may take me a few weeks before I feel connected with this baby. And that doesn't mean that I'm not going to be bonded with this baby. That does not mean that I'm going to be not a good mother to this baby. It's okay to still be grieving the loss of your previous pregnancy and your previous baby, even while feeling excited about your new baby or the new pregnancy. Those feelings aren't mutually exclusive. They can all occur at the same time, and it's completely normal and understandable. Many moms also feel comforted by finding some kind of meaning in their loss, whether it is through outreach with other women, other families who have experienced pregnancy loss, fundraising for a charitable organization that helps families who are dealing with pregnancy loss. There can be so many different avenues to reach out and to connect with other people, especially through social media. It can be helpful too to have mementos of your baby that are saved. Either it's an ornament on a Christmas tree, or a lot of my clients will get a special piece of jewelry that helps them to remember their baby. And it can be a wonderful way of validating the fact that your baby is your baby, no matter how long your baby is here. Know that setbacks are common, even after days and weeks and maybe even months of feeling okay. Usually holidays and anniversaries, the due date can be a difficult day. So take it really easy on yourself and know that you're not necessarily sliding back into the dark days of grief if you do have a setback, because setbacks are completely understandable and normal. And again, if you experience any symptoms at all that are concerning to you, or that are causing you any level of distress, make sure you reach out for help. Either contact your OBGYN, get in touch with a local therapist, let your partner know, let family members know, let people know how they can help you, and don't be afraid to reach out for help. I'm going to have a list of resources here that can connect you to therapists who work specifically with women having issues with perinatal loss and depression and anxiety. If you need anything at all, reach out for help because you are not alone.